Hello, everybody. This is our first mini lecture for the semester, and today we will be covering the core characteristics that are associated with autism spectrum disorder. There are three main objectives that I would like for us to be able to say we accomplished by the end of our asynchronous activities as well as our synchronous meeting on Thursday. First, I want you to be able to identify the clinical or medical criteria for being diagnosed with autism. And then I want you to be able to describe how these ASD characteristics that are associated with autism can impact learning. So first, let's talk a little bit about our clinical criteria. In the United States, the Diagnostic and Statistical Manual of Mental Disorders, or DSM for short, which is created or published by the American Psychiatric Association, they provide the criteria that we use as the basis for diagnosing a range of mental health and developmental disorders, including autism spectrum disorder. The DSM-5 or the DSM is revised periodically, and the current edition is the fifth edition, which was published in May 2013. And so there were some changes to how we identify or characterize autism in this newest edition. And our discussion moving forward in this semester is based on the criteria that's set forth in this fifth edition, which is the most recent edition. Right. So I want to stress here that ASD is diagnosed on behavioral characteristics. So we do not diagnose ASD through a blood test or a brain scan. We don't have that ability right now, nor do we have the research to support that. But because the diagnosis is based on behavioral characteristics, it requires that anyone who's doing diagnosing has to be specifically trained. Usually they're psychiatrists, and developmental psychiatrists in particular, who are specifically trained in the area of autism and in being able to differentially diagnose mental disorders. So under the DSM-5, students with an autism spectrum disorder must display characteristics in two main categories. They must demonstrate or exhibit some type of social communication deficit, as well as exhibiting abnormalities and engagement in restricted behaviors and repetitive mannerisms. Okay. Now, I do want to stress that because this is considered a spectrum disorder, students' behaviors vary across individuals. So they do have the commonalities of having deficits in social communication, but what these deficits look like for one child may not be the same for another child. All right. And that's the same with restricted interest and repetitive behaviors. They look different across each individual. Right? So we've oftentimes heard the saying that if you've worked with one individual with autism, you've worked with one individual with autism. Autism is oftentimes called a heterogeneous disorder, and that's because the severity and presentation of these behaviors vary widely amongst individuals. So let's talk about what these impairments might look like. So individuals, in order to get a diagnosis of autism, you have to show deficits in all three areas of social communication. So the first being deficits in social emotional reciprocity. So this may look like abnormal, what they call social approach. So it's actually a misconception that individuals with autism do not like to interact with other people. The difficulty is more around interacting in socially appropriate ways. So, for instance, when I had one of my students in preschool really liked interacting with his peers, but just didn't know how to initiate social interactions appropriately. So typically he would just go up to another peer and look down at his toes until the peer talked with him. Right? So again, it wasn't that the student did not want to interact, he just didn't know how. right? So that's what we consider abnormal social approach, right? For some individuals, it may look like having difficulties maintaining back and forth conversations, right? They may be skilled at initiating a conversation or asking a question, but aren't so skilled at responding to other people's questions or maintaining the conversation. It may look like a reduced sharing of interests. So the individual with autism can maintain a conversation if it's about a topic that he or she likes, but not so good at maintaining conversation when it's a topic that is of a unpreferred interest. Next is deficits in nonverbal communicative behaviors that are used for social interaction. So, common things might look like poorly integrating verbal and nonverbal communication. So, oftentimes, individuals with autism may use gestures. They may like point and say, look over there. But whereas we're able to integrate our verbal speech and our nonverbal speech pretty seamlessly, for individuals with autism, it oftentimes looks separated. They will either use gestures or use language, but oftentimes they have difficulty integrating both seamlessly. Right? It may also look like abnormalities in eye contact. So either a severe lack of eye contact or almost too much eye contact, that it makes the other person feel uncomfortable. Nonverbal communication also can take the form of facial expressions, right? So, non-verbally communicating how you're feeling through your face. Oftentimes, individuals with autism have difficulties showing more nuanced facial expressions, so they'll readily show the extremes, so happy, mad, sad, but making an expression like I'm confused or more subtle facial expressions oftentimes are absent in a lot of individuals with autism. And then finally, deficits in developing, maintaining, and understanding relationships. So this could look like not adjusting your behavior depending on your social context. So if you were talking to your professor, you would talk to them a lot differently than your roommate, for instance. Right? So a lot of individuals with autism may not adjust their behavior depending on their context. Right? For young children, it could look like difficulties engaging in imaginative play, right, or making friends, or in some cases, not really showing any interest in peers. Right? So, in order to be identified with autism, you do have to show deficit in each of these three areas of social communication. The next general area is restricted interests and repetitive behaviors. And individuals must demonstrate difficulties in 2 out of these 4, right? At least 2 out of the 4. It could be more. All right. So, for restricted interest and repetitive behaviors, it can look like stereotyped or repetitive motor movements. So, for those of you who have worked with individuals with autism, you may have heard the term stereotypy or stimming behavior, self-stimulatory behavior. So that would fall under this category, right? So repetitive motor mannerisms or movements. Okay. Something that also is common in a lot of individuals that would fall under this repetitive motor movement or stereotype behaviors would be lining objects up, right? Flipping movable parts of toys, right? That's oftentimes something we see in young kids. Next would be an insistence on sameness, inflexible adherence to routines, or ritualized patterns of either verbal or nonverbal behavior. So, for a lot of individuals with autism, they become extremely distressed at small changes. So it could look like insisting that a parent drive the same way to school using the same route every day. If there is traffic or a detour, it can oftentimes cause children a lot of distress because there is a break in that routine, right, or a change to their routine. It might look like difficulties with transitions. So, transitioning between activities, especially if you're going from a preferred activity to an unpreferred activity, right? Rigid thinking and patterns. So, there's only one way to do it, right? When I brush my teeth, I have to use this type of toothbrush with this type of toothpaste and do it in this type of order, right? So being very rigid in their behavioral patterns or the way they think something should be done. Next is highly restricted fixated interests that are abnormal in either intensity or focus. So it is a very typical thing to have, especially in young children, to have a preferred character or preferred activity. But what makes it different in autism is that it's highly restricted and it's abnormal either in what they're interested in or in its intensity, right? So when I was teaching, Thomas the Train was, a big popular thing with preschoolers. But what made it different for some of our kids with autism is that everything revolved around Thomas the Train. They needed to wear their Thomas the Train pajamas, Thomas the Train shoes, right? Would only read books about Thomas the Train. Whereas in other typically developing kids, they liked Thomas the Train, but they would be open to, wearing a different set of pajamas or reading a different book at circle time, right? So that's an example of where it's more intense for an individual with autism. On the other hand, their interest might actually be abnormal in topic. So I also worked with a student who was really fixated and interested in fans, so electrical fans. So one of his favorite activities was looking through a fan catalog, and he had every fan type memorized as well as the serial numbers. So that's an example of an interest that is abnormal in its topic, right? Because that's not something that most preschool children would be interested in, or at least not to that extent, right? And then finally, hyper or hypo reactivity to sensory input, right? Or unusual interest in sensory aspects of the environment. So let's talk about this hyper or hypo reactivity. So if you think about your different sensory sensations, right? We have olfactory, we have auditory, we have tactile, right? We have taste. So we have a bunch of senses. But what's different or markedly different or qualitatively different with individuals with autism is that it's either hyper, like super sensitive, or undersensitive to some of these things, right? So this may be having an undersensitivity to pain or temperature, right? Or maybe being hypersensitive to smells in the environment. So you and I might not detect a smell, but it may be really noxious to an individual with autism. So either being hyper reactive or hypo reactive to sensations, um, or having an unusual interest in sensory aspects of the environment. So sometimes you might see individuals looking or peering at objects differently. So calling that visual inspection. So kind of looking at something out of the corner of their eye or being very fixated on a reflective portion of an item. Right? So being drawn or attracted to unusual sensory aspects of their environment or materials. Now, when clinicians are diagnosing autism within individuals, oftentimes they'll include what we call additional qualitative specifiers. And this is intended to provide additional information about the individual who's being diagnosed. So clinicians specifically specify whether the individual meets the criteria for autism, as well as whether he or she has additional impairments, including intellectual impairment. And our current understanding is that roughly 75% of individuals with autism also do have an intellectual impairment, which is defined as an IQ below 70. Right? You can also have autism with a language impairment, right? Which affects roughly 4% of the autism population. Whether or not there's a known medical condition that is comorbid with their autism diagnosis. The most frequently associated medical condition associated with autism is Fragile X. And then catatonia, which actually affects around 17% of the autism population. So catatonia is a motor dysfunction that causes rigid involuntary tensing of the motor muscles. Okay. In addition to identifying autism and then specifying whether or not there are additional specifiers that are met, clinicians will also indicate their evaluation of how much support that individual needs. So, talking more about severity of these symptoms. So, what is the extent to which these symptoms will impact their ability to function in a natural school or community setting? So they would specify a severity level for social communication as well as a severity level for restricted interest and repetitive behaviors. So a level 3 means that they would require very substantial support. Level 2 means they require substantial support. And level 1 is requiring some supports. All right. So, for example, a person who has a few words of intelligible speech, but who rarely initiates interaction, or when he or she does, will make unusual approaches to meet their needs, they would most likely be rated as a level 3 in terms of their social communication. Compared to a person who speaks simple sentences, interaction, but whose interaction is limited to their specified interests, um, and might have some markedly odd nonverbal communication, would be rated as a level 2, right? Compared to a person who speaks in full sentences, engages in communication, but has difficulty with back and forth conversations, right? And their attempts to make friends are typically odd or unsuccessful, they might be a level 1. Now, I did mention that the DSM, the Diagnostic and Statistical Manual for Mental Disorders, they are updated periodically. DSM-5 came out in 2013, and with the DSM-5, they did change the criteria that we use now to define autism. So let's talk about some of the changes that were made between the previous version, which was DSM-4, and the current version that we're using, DSM-5. So under the DSM-4, autism fell under the general umbrella category of pervasive developmental disorders. Under DSM-5, the umbrella category is neurodevelopmental disorders. So in the DSM-5, they recognize that autism does originate as a neurological disorder. Right? Under DSM-4, there were 5 categories under pervasive developmental disorder. Right? The 3 that were associated with autism spectrum disorder were Asperger's syndrome, autistic, and pervasive developmental disorders not otherwise specified. Right? The other 2 categories that were under PDD but not considered part of the autism spectrum was childhood disintegrative disorder and Rett syndrome. Right? Under the DSM-5, they no longer separate out Asperger's from PDD, NOS, and autistic disorder. Instead, it's all just one category. So that means that Asperger's is not a recognized category under the DSM-5, but rather they're viewing ASD as a spectrum that encompasses all 3 of those categories now. And childhood disintegrative disorder and Rett's have moved under a different umbrella category. Right? Under the DSM-4, there was a symptom triad that we talked about. So we looked at autism as being deficits in social interactions, deficits in communication, and restricted and repetitive behaviors and mannerisms. And under those 3 broad categories, there were 12 possible criteria, and a clinician could diagnose someone as long as they met multiple criteria combinations. Under the DSM-5, they tried to streamline that a little bit. So instead of having a symptom triad, so instead of having social interactions and communication separately, they actually combined it in DSM-5 because they recognize that communication is inherently social. You cannot separate out social from communication. So for that reason, under DSM-5, we now talk about it as being a symptom dyad. So deficits in social communication, which are together now, and then restricted and repetitive interests and behaviors. Right? Under the symptom dyad, there are 7 possible criteria that clinicians look at, 3 under social communication, 4 under restricted and repetitive behaviors and mannerisms, and you need to have a combination of 5 of these criteria in order to receive a diagnosis of autism, right? All 3 in social communication deficits, and then 2 out of the 4 in the restricted interest and repetitive behaviors. Right? There's also a difference in when the individual needs to demonstrate these deficits. So under the DSM-4, the individual who was being diagnosed had to currently demonstrate these deficits. Right? However, under the DSM-5, they acknowledge that with intervention, you may not necessarily demonstrate or might not be as severe in some of these behaviors, but that doesn't mean you don't have autism, right? So under the DSM-5, the individual needs to currently demonstrate it or have a history of showing some of these behaviors. Okay. Lastly, under the DSM-4, the individual has to currently show the behaviors, and these behaviors needed to start prior to age 3. Under DSM-5, they broadened it. They didn't specify a specific age range, but they do specify that it needed to start sometime in the early development period. All right. So why change the criteria, right? Well, these new criteria was the product of many years of work by professionals in the area of neurodevelopmental disorders. Over the years, we've started to understand a lot more about autism, right? As part of their review process and creating these new guidelines, there was a task force that was created, and several work groups reviewed the scientific literature, including the newest research that was emerging in the area of autism. Okay. Changes in the criteria were based primarily on new insights emerging in the research since 1990, when the previous version was published. Well, first, researchers and clinical practitioners know that believe that a single spectrum category better reflects the symptom presentation as opposed to having 3 distinct categories, which is why they went away with separating out Asperger's from autistic disorder from PDD and OS, right? In clinical practice, it just made more sense to have one broader category that encompassed a range of abilities. Right? Second, separating out ASD from typical development was reliable. So we can reliably separate autism from those who are typically developing. But it is much harder to reliably separate disorders within the spectrum. So again, Asperger's, one clinician might identify someone as Asperger's, and another clinician might evaluate that same person as having PDD and OS, right? So the difficulty was that clinicians weren't reliably diagnosing these separate categories, right? And oftentimes they were being used interchangeably. So such as saying I have high functioning autism versus Asperger's, right? So that's another reason or another argument for just making one big umbrella category, is because the diagnosing of these subtypes were not reliable, right? Third, many states provided services only for those who were diagnosed as autistic disorder, right? So even though in the DSM-4, autism spectrum disorder was encompassed, autistic disorder, Asperger's, and PDD and OS, many states were only providing services to individuals if they qualified under autistic disorder, right? So as expected, a lot of clinicians would not identify or diagnose PDD, NOS, or Asperger's disorder, right? Because it didn't provide any extra services to those students. Now, I do want to stress that everything we've talked about right now, especially with the DSM-5, those are criteria that we use to diagnose autism for clinical or medical purposes. Okay, that's something that a psychiatrist does. Do want to stress that a clinical diagnosis does not automatically mean that the individual qualifies for special education services, all right? Now, individuals with autism can qualify for special education services if their behaviors warrant it or are impeding their ability to access or learn in school settings. But in order to qualify for special education services, that is determined by the school district's educational team, right? So they conduct their own separate school evaluation, right? And oftentimes it is the school evaluation will use the same structure or the same framework as the DSM-5 in order to identify it, but it has to be determined by a school team. So just because an individual gets a medical or clinical diagnosis of autism, that doesn't automatically mean that they receive special ed services. All right, so we talked a lot now about the clinical characteristics associated with autism, but let's talk about how these clinical characteristics can impede learning. Now, this is particularly important for us as educators, therapists, and other working professionals, right? Because we're not in the business of diagnosing for clinical purposes, but we are in the business of teaching individuals with autism, right? The diagnosis alone is only going to give us a starting point. It will provide us with some helpful hints about where to look for strengths, as well as identify potential areas of need. But each individual is going to need to be considered independently in order for us to maximize our instruction for that individual. Now, your textbook covered some of the considerations when planning interventions for students with autism, and we will continue to discuss this throughout the semester, right? The main point is that the receiving a diagnosis of autism is just the starting point. We really are going to be considering the individual when we're creating our instructional plans, right? And then when we consider the individual, we're focusing on strengths as well as areas of need and incorporating their interests and motivations in the strategies that we're going to use in our instruction. All right, so let's talk a little bit about common strengths. So again, I don't want you to get this confused with diagnostic criteria, right? Nowhere in the diagnostic criteria do we list cognitive features of autism, but it is helpful for us as future practitioners and educators to understand what are some of the common behaviors that we might see in our classroom, right? Specifically as they relate to learning. So oftentimes, individuals with autism show strengths in rote, rule, fact-based learning. So when I was teaching, oftentimes I would hear parents say, my kid is just so smart in some areas. He knew his ABCs when he was 2, right? And he can tell you the times tables up through, his 12s, which is really great. But one of the reasons why that is a lot easier for individuals with autism to learn those type of skills versus other skills is because those are very rule, fact-based learning, right? Rote learning tends to be a strength in many individuals with autism, right? Individuals with autism tend to do extremely well when given concrete supports, okay? They respond well when the directions are clear and the consequences are explicit. They do well with routines and structures. So having a predictable routine is helpful for all learners, but especially learners with autism. And also having highly structured activities tend to be something that individuals with autism excel in. As opposed to, say, having an art activity where the teacher just broadly gives the direction to explore your creativity and use any material in the classroom. Something that's open-ended and free would be difficult for a lot of our learners with autism who would benefit from highly structured activities that have clear rules and clear outcomes. Another area of strength tend to be learning the mechanics of language. So the majority of individuals with autism do develop speech. It may be delayed, but they do eventually develop speech, with most being able to speak fluently in full sentences. So they are able to learn the basic mechanics of language and how to put together language. Where they have more difficulty, though, is in the pragmatic use or application of language. So, yes, they are able to use full sentences, but maybe they only use it to request for items or to request for information, but will not use full sentences to engage in other social functions. Right. Let's talk about potential needs that, again, are not a diagnostic characteristic, but are common to a lot of individuals with autism. Right. So I oftentimes think about potential needs for this group as a camera, right? Where their strengths are really, like their camera is really zoomed in, right? So they're really great at focusing on the details, right? And looking really closely at a narrow image, right? Where they're having difficulty is zooming out and seeing the bigger picture. Right? So a potential need might be supporting individuals and being able to kind of predict events and order. Right. So imagine you're working in an assembly line and you're making cupcakes for a school baking fair, right? And each person has their job. So the individual with autism is at the end and puts the icing on top, right? So he may be really great at knowing his job, but isn't able to tell you what happens before he receives the cupcake to put the icing on top, right? So being able to explain the bigger picture or the sequence of, well, first someone makes the batter, then someone pours it, right, into the baking tin. Right? So predicting events and order oftentimes is a potential need for many individuals with autism. Using and understanding language and discourse. So again, this talks to the pragmatic or applied use of language. So using language for social purposes or a variety of purposes. Or understanding slight nuances in language. So oftentimes individuals with autism are quite literal, which means that they don't pick up on sarcasm well, or they don't pick up on idioms well, don't understand idioms, right? So I was just having lunch with my daughter who wanted a whole chunk of brownie, and I told her, your eyes are bigger than your stomach, right? So that kind of expression, your eyes are bigger than your stomach, would not be oftentimes comprehended by most individuals with autism who take things very literally. Right? Related to that is difficulties comprehending text. So, literacy development in individuals with autism is actually quite interesting in that oftentimes they show strengths in the basic mechanics of reading, meaning they can learn how to decode text, they can look like they read fluently. But if you were to ask them a comprehension question about what they read, right, they would struggle with that. Right? So understanding language at a deeper level. Right? They may have difficulty organizing and integrating information. Right? So oftentimes when you're reading a book, skilled comprehenders and skilled readers will connect what they're reading to something else that they know. Right? So being able to integrate information from other sources or other experiences tend to be difficult with individuals with autism unless they're given extra support to do that. Right? Individuals with autism also may need help attending to multiple stimuli or cues. So remember having kind of that sticky attention where they're really good at focusing on one thing, but then the rest of the world kind of disappears because they're so focused on the one thing. Right. So imagine that would have implications for lots of learning, but especially you say you're driving down the road, right? If you are hyper focused on the stoplight, you're not paying attention to other stimuli that you need to attend to, like the person in the crosswalk who's about to step in the street, right? So attending to multiple stimuli is something that individuals with autism tend to have difficulty with, as well as shifting focus, right? So that's also related to this sticky attention where they get really focused on one thing and have difficulty shifting their focus or transitioning their focus to something else. Right? Knowing what stimuli to focus on, distinguishing relevant from extraneous information. Right? So you're reading a passage which has lots of great information, but then the teacher asks you a question that refers to just one part of that passage. how do you distinguish what is important to attend to versus what information that's not as important to being able to answer this question? Okay. And finally, generalization. So this is something that is an issue for a lot of individuals with autism, but also individuals with severe disabilities broadly, is that they have difficulty generalizing the skills that they learn in one setting or one situation to other settings. So they can do it at school, but they're not doing it at home, right? Or they'll do it for one teacher, but not for another teacher, right? So those are issues around generalization that we fortunately know how to address those issues through teaching, right? But these are general potential needs that we will need to be aware of as educators so that we are able to support and teach our students more effectively. All right, so let's put this into a more applied context. I think what's important and sometimes misleading about a lot of individuals with autism is that the strengths that we just talked about oftentimes can mask some of the difficulties they're having, right? So for some individuals, it may appear that they have typical or even advanced language abilities, right? So it looks like they're speaking in full sentences, right? They have a broad vocabulary, but if you look closer at it, you'll notice that the student is struggling with using the social aspects of language, right? Or comprehending language. So that example of non-literal language, being able to connect what they're saying in a seamless way to what others are saying, right? Making inferences, right? So even though it may seem like they have average to even strong language abilities, there are specific areas within language that they're going to struggle with. Right? A lot of times, teachers or parents may, because an individual is really great at focusing on detail, following rules, and have strong rote memory, they oftentimes overlook that they might have difficulties with other cognitive tasks like organizing information, integrating that information with information they've learned before, right? Attending to other stimuli in their environment, right? Understanding kind of the more abstract things, right? And generalizing the skills they learned, right? So it's important to not, it's important to know the strengths and to build upon strengths, but not to let that mask other difficulties that the individual might be having, right? Additional characteristics that are often associated with autism is a comorbid intellectual disability, um, as well as learning disabilities like ADHD. Um, Oftentimes, individuals with autism may qualify for additional occupational therapy services due to having sensory integration issues. And more now, we're seeing a lot of comorbid mental health issues exhibited by older individuals with autism, primarily anxiety, depression, and OCD, obsessive compulsive disorder. Also common in some individuals with autism are physical health impairments related to sleep issues, GI issues, so gastrointestinal issues, um, sensory sensitivities, behavior problems that are often related to having communication difficulties, um, having limited adaptive skills, being able to take care of oneself. And we're also seeing a big body of research come out pointing to the fact that individuals with autism are also the victims of bullying in schools and communities. All right. So that concludes our mini lecture on the characteristics of autism. So you have some remaining asynchronous tasks that you'll need to complete before we meet on Thursday. There are 2 additional video links that I posted on our Canvas site. You will also be responsible for reading Chapter 1 and completing your discussion role based on what you've read. There's also a really brief knowledge check just to hold you accountable for completing all these asynchronous tasks. And I would also like you to nominate at least 3 focus intervention strategies that you'd be interested in becoming the expert on for your first assignment. All right, that is all. I will see you on Thursday. Bye, everyone.